This is an overview of the coronial findings into the death of JJKD. JJKD was a 34-year-old man with schizoaffective disorder and depressive episodes. He was 34 at the time of his death. He had a long-standing history with mental health services, but the real trouble began in late 2015. He had been on a number of antipsychotics. There was no information in the report as to how effective they were, presumably not that good because he ended up being put on clozapine. The clozapine serum levels were often suboptimal. Therapeutic range is 250 to 550 micrograms per litre, and his were coming in at 70 to 450 micrograms per litre. He had been doing all right. He started attending the clozapine clinic with the case manager, but then went on his own, which he was quite reliable at doing. His mother reports he was doing okay. But by September 2015, he was down to 150 milligrams a day with a view to reducing that to 50 milligrams a day. And the plan was to put him on an antidepressant when that was ceased. At the end of September, he started self-harming, and he also started using cannabis to help manage his increasing agitation. An emergency examination order was done, but he was sent home. He was visited at home by the continuing care team case manager, who assessed him as being of low to moderate risk to himself and others. Over the next 7 weeks, from late September, his mother made 5 calls to the service and attended 6 consultations with her son where she expressed her concern regarding his deteriorating mental state. JJKD was transferred from a private psychiatrist to a community-based psychiatrist, and in amongst that he was also sent to his GP for case management. The coroner remarked that there was only one record of communication between treating teams. So his care was quite fragmented, and the communication between the teams was not good at all. Having said that, his case manager, the mental health nurse, was consistent and had been since 2013. In November, the clozapine was ceased and aripiprazole was commenced. There was an antidepressant commenced at some point. However, JJKD's mental state continued to deteriorate insofar as he was not sleeping, he was delusional, he had perceptual disturbances, and he lacked insight. He felt he was feeling better, so he stopped taking his medication. He was reviewed again in November. There were no acute grounds for enforced admission to a mental health unit, but there is no mention in the report as to whether or not it was recommended to him that he enter as a voluntary patient. Over the Christmas period, there were staff shortages due to annual leave, and the case manager not only had their own workload, which was quite large, they then had to take on the workload of their colleague over this period. So the assessments that were being done were really only providing snapshots of where he was at that time. During this period, he visited a McDonald's store and became verbally abusive, threatening and agitated. He decamped before the police could arrive. This was revealed to the case manager 2 days later when he attended with his mother, who was continuing to alert services about his deterioration. By now he was also using methamphetamine as well as cannabis. He was referred for an immediate review, but this did not happen. He was reviewed again on December 23. That's when he disclosed that he had stopped taking his medication, although the time frame of when he stopped taking that medications is not clear. He clearly lacked insight at this time. He wanted to stop his disability, support pension and find a job, which he was clearly unable to do. Again, he was found to be at low risk to himself and others, but he was commenced on a depot injection of aripiprazole, and the next review was planned for 4 to 6 weeks' time. On December 31, he made the fateful decision to go surfing in dangerous conditions, and he subsequently drowned. So what went wrong? The clozapine dosage, as mentioned, resulted in suboptimal blood levels. This could have been monitored a lot more closely. Indeed, one of the recommendations from the coroner was for a review of the clozapine clinic processes. This happened in Queensland, obviously, but this does not automatically transfer nationally. For those of us who live in other states, such as myself, who lives in Tasmania, that the benefits from this recommendation are not necessarily going to be felt by us. It behooves the nurse to pay attention to what's going on in the clinic. The doctor should be doing this as well, but certainly the nurse can be keeping an eye on it. More frequent monitoring as his clozapine levels were reduced would have been beneficial as well. He was already showing signs of agitation at 150 milligrams, but the dose continued to be reduced until it was ceased altogether, to be replaced by oral aripiprazole, for which he was not particularly compliant as far as we know. The other thing that went wrong here with JJKD's care was that he was pushed from pillar to post. There was not a lot of continuity of care. There was not enough communication between treating teams. His nurse was constant throughout this time, but the staff shortages really hampered a good close monitoring of his care. Another problem was that even though the mother was quite vocal in raising her concerns for her son, her concerns were not really taken into account. And this is a great shame because, especially in the light of staff shortages, she was really in a position to give some excellent insight into what was going on, what his needs were. The nurse is the health professional who has the longest association with the patient, but the family has the longest association, full stop. So they really need to be part of that collaborative team. Indeed, person-centred recovery is greatly enhanced when the family can be involved. If a person is in a manic phase and can't really sensibly speak for themselves or say what is really going on for them, the family can offer some really good insight into where they're at, what's been going on, what their needs are, what has helped in the past. Who knows, going surfing may have been a way that JJKD relaxed and switched off from the world in the past, and maybe this is what he was trying to do this time, but lacked the insight to recognise that the conditions were unsafe. Lastly, we need to be aware of the triggers that present themselves for increased monitoring, and there were two that were identified by the coroner. The first was the incident at McDonald's. It was quite a clear trigger. The customers and staff alike at McDonald's would have felt quite unsafe with him rampaging around, and at the very least this should have triggered increased surveillance or monitoring of him, and possibly even an admission into the acute care unit. The other warning came not long afterwards when he announced that he wanted to give up his pension and find a job. This demonstrated quite a lack of insight. The nurse has a very important role in monitoring the patients and alerting the doctor and other members of the multidisciplinary team for the best outcome for our patients.